Swimming to me means the world. It's been such a big part of my life. From the moment I started swimming, I became very, very passionate about it, and that's why I want to continue swimming in college. I first started having problems with my ankle when I was about 13, when there was a time when I didn't think I would be able to compete anymore. That was pretty devastating.
Lexi rolled her ankle, and we thought it was a simple ankle sprain or strain. Over time, it became worse and worse, and the pain started to increase. She was having much more difficulty doing the things that swimmers need to do to be successful. It was extremely painful to kick. It was painful when she pushed off the wall. It got to the point where it was keeping her awake at night.
I became extremely discouraged just with the whole sport, and I wasn't sure I even wanted to continue swimming anymore.
Ankle injuries are very common. However, Lexi has a very special case that only affects about 0.5% of the ankle injuries sustained in America. It is a peroneal tendon dislocation. The tendon is sitting at a position where if she moves in a certain direction, it can certainly snap back and forth between the bone, causing irritation of the tendon as well as pain and also sometimes even weakness. She also has a very shallow anatomic deformity that predisposes her to further injury. The next step is actually create a deeper groove for the patient to control the tendon and keep it inside its home.
Dr. Schur recommended that I have a tendon reconstruction and groove deepening surgery.
Meeting Dr. Schur was a watershed moment for Lexi.
So that's the
He really gave her the confidence that if she at least did the surgery now, she would probably have a good chance of swimming in college if she chose to.
Surgery in the athletes especially, you have to be very careful because you want them to not only just be functional, but also compete. Physical therapy in this case is very important. Our therapist has been very good in helping her get back to not only walking, running, but also at a competition level.
I thought that I would be giving up my entire season for senior year, but I ended up doing much, much better than I'd expected and decided that it might be worth it to consider training for states.
All right, last set here.
Lexi's a fierce competitor. We were fortunate enough that Lexi was able to help us on our 400 free relay.
Going from having ankle surgeries 3 months before to competing in the state championship meet, which I never expected to be a part of, was an incredible experience. When we realized we'd won and it was the final event of my high school swimming career, it was a very awe-inspiring moment. Everybody hugging and crying. We were all so happy. I'm most grateful for just Dr. Schur and his whole team. This experience has shown me how much a doctor can make a difference on a patient's life.